Take advantage of it while you can. COVID test kits, treatments, and vaccines won't be free to many consumers much longer. I'm Tyrone Bowman. This is Tyrone Bowman Tonight. According to NPR or National Public Radio, time is running out for free to consumer COVID 19 vaccines, at home test kits, and even some treatments. The White House announced this month that the national public health emergency, first declared in early 2020 in response to the pandemic, is set to expire May 11. When it ends, so are many of the policies designed to combat the virus's spread. COVID vaccine marketers are poised to raise prices. Take vaccines. Until now, the federal government has been purchasing COVID 19 shots. It recently bought 105 million doses of the Pfizer BioNTech bivalent boosters for about $30.48 a dose, and 66 million doses of Moderna's version for $26.36 a dose. These are among the companies that deployed the first COVID vaccines sold in the United States. People will be able to get these vaccines at low or no cost as long as the government purchase supplies last. But even before the end date for the public emergency was set, Congress opted not to provide more money to increase the government's dwindling stockpile. As a result, Pfizer and Moderna were already planning their moves into the commercial market, both having indicated that as soon as that happens, they will raise the price they charge somewhere in the range of $110 to $130 per dose. Though insurers and government health programs could negotiate lower rates, we see a double-digit billion-dollar market opportunity. Listen to me carefully. It's all about the money. At the end of the day, ladies and gentlemen, it's all about the money. And if you don't believe me, check out my 3-part series entitled America Runs on Money. Now back to the article. That could translate into tens of billions of dollars in revenue for the manufacturers, even if uptake of the vaccines is low. And consumers would foot the bill either directly or in copays or indirectly through higher premiums and taxpayer-funded subsidies. If half of adults, about the same percentage as those who opt for an annual flu shot, get a COVID shot at the new higher prices, a recent KFF report estimates insurers, employers, and other payors would shell out $12.4 billion to $14.8 billion. That's up to nearly twice as much as what it would have cost for every adult in the U.S. to get a bivalent booster at the average price paid by the federal government. As for COVID treatments, an August blog post by the Department of Health and Human Services Administration for Strategic Preparedness and Response noted that government purchased supplies of the drug Paxlovid are expected to last at least through mid-year before the private sector takes over. The government's bulk purchase price from manufacturer Pfizer was $530 for a course of treatment, and it isn't yet known what the companies would charge once government supplies run out. One thing is certain: how much, if any, of the boosted costs are passed on to consumers will depend on their health coverage. Medicare beneficiaries, those enrolled in Medicare, the state federal health insurance program for people with low incomes, and people who have health plans via the Affordable Care Act exchanges will continue to get COVID 19 vaccines without charge, even when the public health emergency ends and the government purchased vaccines run out. Many people with job-based insurance will also likely not face co-payment for vaccines unless they go out of network for the vaccinations. People with limited benefit or short-term insurance policies might have to pay for all or part of their vaccinations. And people who don't have insurance will need to either pay full costs out of pocket or seek no or low-cost vaccinations from community clinics or other providers. If they could not find a free or low cost option, some uninsured patients may feel forced to skip vaccinations or testing. Coming up with what could be $100 or more for vaccination will be especially hard if you are uninsured or underinsured. That's where these prices hikes could drive additional disparities, said Sean Robbins, Executive Vice President of External Affairs for the Blue Cross Shield Association. Those insurers, he said, will also affect people with insurance as the costs flow through to premiums. Meanwhile, public policy experts say many private insurers will continue to cover Paxlovid, although patients may face a copayment, at least until they meet their deductible. Just as they do for other medications, Medicare will continue to cover it without cost to patients until at least 2024. Medicare beneficiaries will face cost sharing for most COVID-19 treatments once the emergency officially ends and the government supply runs out. Meanwhile, the treatment will also need to go through the regular FDA approval process, which takes longer than the emergency use authorization under which it had been marked. Another complication: the rolls of the uninsured are likely to climb in the next year, with states poised to reinstate the process of regularly determined Medicaid eligibility. That sort of review was halted during the pandemic. In April, states will begin reassessing whether Medicaid enrollees meet income and other qualifying factors. An estimated 5 million to 14 million people nationwide could lose coverage. This is our number one concern right now, said John Bakers, CEO of LA Cure, the nation's largest publicly operated health plan with 2.7 million members. They may not realize they've lost coverage until they go to fill a prescription or seek other medical care, including vaccinations, he said. Rules remain in place for insurers, including Medicare and Affordable Care Act plans, to cover the cost of up to 8 in-home test kits a month for each person on the plan until the public health emergency ends. For consumers, including those without insurance, the government website is still offering up to 4 test kits per household until they run out. The Biden administration shifted funding to purchase additional kits and made them available in late December. Starting in May, though, the beneficiaries in original Medicare, and many people with private job-based insurers will have to start paying out of pocket for the rapid antigen test kits. Some Medicare Advantage plans, which are alternative to original Medicare, might opt to continue covering them without a copay. Policies will vary, so check with your insurer, and Medicaid enrollees can continue to get the test kits without cost into mid-2024. Overall, the future of COVID tests, vaccines, and treatments will reflect the complicated mix of coverage consumers already navigate for most other types of care. From a consumer perspective, vaccines will still be free, but for treatment and test kits, a lot of people will face cost sharing, said Jen Cates, a senior vice president at KFF. We're taking what was universal access, and now we're going to back to how it was in the regular U.S. health system. I'm Tyrone Bowman. Never surrender, never quit.